So what are the symptoms of the low T syndrome? Slide 21 and onwards. It's a low energy. It's a presence of at least 3 sexual symptoms, such as decreased sexual interest, loss or decreased morning erections, and erectile dysfunction, which is subjective parameter, decreased muscle mass, lean muscle mass, and decreased muscle strength, increased body fat level, which has to be assessed with a body composition test, depression, cognitive decline, lower pace, which stands for the physical activity score of the elderly. It's the shorter walking distance, it's the less amount of the squats and the sit-ups that a person can do. It's a reduced 50 feet walking gait and speed, and decreased bone mineral density. Also, low testosterone syndrome is highly associated with metabolic syndrome, with at least 3 of the following risk factors, specifically weight circumference of 102 centimeters or greater, triglyceride level increase more than 1.7 millimole per liter, and HDL levels decrease with less than 1 millimole per liter. Plus changes in the blood pressure. It's a systolic pressure greater than 130 and the diastolic pressure greater than 85 millimeter. Fasting glucose levels of 5.6 millimole per liter or more, and lower hemoglobin levels. If we want to assess the hormonal profile, the total testosterone numbers, according to the latest guidelines, total testosterone level less than 12 nanomole per liter is severe hypogonadism. Free testosterone levels less than 0.2 nanomole per liter also correspond to severe hypogonadism. And of course, there is a free androgenic index. Reduction in the free androgen index is also a symptom of the low T syndrome, plus the increased LH and FSH, and changes in a ratio of the estradiol to testosterone. And there's a dichotomy here. There can be a dramatic drop or reduction in the estradiol, or on the contrary, especially in the obese man or men who are affected with the fatty liver disease, in proportionate increase in the estradiol levels. What are the outcomes or the impacts, the effects on the general health of the low testosterone syndrome? It's a frailty, it's sarcopenia, reduced muscle mass and strength, osteopenia, obesity, cognitive decline, low libido, erectile failure, including the absence of morning erections. It's a higher occurrence of the cardiovascular disease at any age. And a testosterone insufficiency in men is found to be associated with increased risks of death over the following 20 years from the moment of its onset, independent of multiple risk factors and several pre-existing health problems. So that is one single very important factor that will influence the not only quality of life, but the longevity overall. Yeah, because from the moment when the person is diagnosed with a low testosterone syndrome, they have an increased risks of shortening of lifespan within the next 20 years. It is important to understand the notion of the phenomena of the hypothalamo-pituitary adrenal gonadal axis. It's the orchestration and correlation of the function of the hypothalamus that will produce specific biological substances stimulating the pituitary gland, that will further excrete hormones that will influence endocrine system. But in the context of today's conversation, adrenals and gonads, they will in their turn produce hormones that will provide a negative feedback on the hypothalamus and overall regulate the level of endogenous production of hormones. And slide 26 illustrates it. There are three main sites of hormonal production and hormonal effect that, as long as today's topic is concerned, it's brain, hypothalamus, pituitary gland, it's adrenals and its gonads, testicles, specifically in